Today we are going to talk about breast cancer. Breast cancer is the commonest cancer among females in the world, and this is the same in Sri Lanka as well. In Sri Lankan women, the commonest cancer is breast cancer, with around 4,000 to 5,000 new patients diagnosed each year. So it is very important for us to have a good understanding about breast cancer. First, let's have a look at how a breast cancer can present. The commonest way a breast cancer can present is like a breast lump. There are many other ways a breast cancer can present as well. Some of these are: there could be a change in the breast shape or the size. There might even be a change in the nipple shape or even the size of the nipple. Sometimes breast cancers can present with discoloration of the skin or a difference in the texture of the skin. So likewise, there are many ways a breast cancer can present. So what we need to know is how can we identify breast cancer early and present to our doctor early. Early detection is the way forward in battling breast cancer. So how can we identify a breast cancer early? We recommend 3 steps. Firstly, self-breast examination. Secondly, clinical breast examination. And thirdly, screening mammogram. Let's take this one by one. What is self-breast examination? We recommend this to all females above 20 years of age. Self-breast examination should be done once a month. If you are a female who are having menstruation or periods, you need to pick a date after menstruation or after periods. If you are a female who does not have periods or menstruation, you can pick any date on the month. So first pick a date. Then the next step is to carry out the self-breast examination. This will take about 2 minutes of your time. Have a look at your breasts. Feel your breasts. Make sure you get to know what is normal for you. When you do like that, you will immediately recognize a change in your breast earlier. This way, you can present to your doctor early when you feel there is an abnormality in your breast. The second way is clinical breast examination. Here, we recommend you to get a checkup done by a doctor maybe once a year to see whether you have a healthy breast. The third step is screening mammogram. We recommend this to females above 40 years of age. We generally recommend to take a screening mammogram once in 2 years. In this way, we can identify a lesion at a very early stage. If you adhere to these steps, you will be able to identify a breast cancer very early. Now let's look at what will happen if you present to the doctor with a suspicious lesion. If the doctor is suspecting that you are having a breast cancer, he or she will do some tests to confirm the diagnosis. Usually, this will start with an imaging such as a mammogram and an ultrasound scan of the breast. After this, you will undergo a biopsy test where a piece of tissue will be taken from the suspicious area to confirm the diagnosis. If by any chance you are diagnosed with breast cancer, do not be alarmed. There is treatment for you. It is important for you to comply with the treatment. So what are the treatment for breast cancer? Mainly we have breast surgery. This can be in the form of removal of part of the breast or complete breast. But even if the complete breast is removed, there is provision for breast reconstruction. Apart from this, we also treat breast cancer with chemotherapy, hormonal therapy, and radiotherapy and other various forms of treatment. Your doctor will advise what is best for you. So today, we have looked into a small overview about breast cancer. My take-home message for you is early detection will save lives. So adhere to the practices of early detection.